Hey everybody, what's up?
Dr. Greg Naiman, Dr. Ted Naiman, just taking you back to our old stomping ground.
Yep.
See where it all started. Here we're.
Yeah, this brings back a lot of memories. I'll tell you. So when we first moved to this country, I was about 5. Greg was about 6 or so. We landed right here in Danbury, famous Danbury Street.
7 Mile over in Detroit. Again, went to that church right across the street.
This was the Chaldean church here that we went to, and man, we spent many times getting yelled at by all the the nuns and the priests and stuff. But you know, flashback. Remember us riding our bikes up and down the streets here. You know,
walking to church. Back when there was actually a lot of houses on the street.
Right. Yeah, and back in the day, this place was, you know, it was hopping. It was a lot of action going on, a lot of things going on. Unfortunately, right now, you know, it's not the same as, you know, when we were here, but still a lot of memories, a lot of good memories. Could have never imagined, you know, the fact of, like, at that time, you know, our future, where it would hold. But again, this is our old stomping grounds. This is where it all started.
The reasons why we do what we do is, again, going back to communities where we grew up in and try to bring back the quality health care.
Yeah.
A couple of blocks down were 2 physician brothers who actually took care of our family. So Dr. Kuhn and Dr. Kuhn.
They were great family practice doctors that just, you know, again, kind of the same. It was the community. They're helping out the community. Really did a lot. I mean, many times where, like, they wouldn't charge us because we didn't have insurance. It was one of those things where
back in the day, remember, bro, like when you go there and see them, they would actually dispense medications right in these little manila envelope type things where they would say, okay, here's your medications that you need, they give you so many, hand it out to you, and then that's what you would take for that duration.
Right, because they knew that if they didn't give it to us at the office, we were probably going to get it because we couldn't afford it.
You know, that's where we grew up, and we're like, hey, how do we give care back like this into the community? Personalized, back to, you know, relationship. They knew all the families, they knew everybody, everybody knew them, took care of them.
Yeah, boy, and you remember this party store here? It was, I think it was called like 7 Brothers or something like that. It was like, back in the day, we would come here, get candy from the party store, hang out. We would here, the Greenfield Union, this is where we would come every morning during school year.
Here.
And in fact, actually, the ironic thing was when my wife, you know, she got her teaching degree and she actually came back and was teaching here 3rd and 4th grade for almost 5 years or so. It was great. They couldn't really necessarily afford things, so we would buy all the books and all the equipment for the kids. And a lot of times, like, a couple times we paid for them to take them to the Detroit Zoo because they couldn't afford it. But, you know, again, but that's what you do. Like, you know, you take care of the community and, you know, you give back.
That's takes care of you.
All right, guys, so we're actually here. This takes us back many years. I see the old gymnasium there through the windows where we used to play. Then they turned into a cafeteria.
Back in the day, you know, we weren't the greatest of students, right? That's not what you focused on when you're growing over here. But, like, luckily our parents kept pushing us, and we got better and did better at school. Crazy to think, like, you know, we were here, started as children, grew up in this neighborhood, and then, you know, years later, we take over a medical practice just a couple streets down the street.
Right.
We should probably go there next and check out where we first started our medical practice.
Come on, let's do it. I'm excited. Let's get going. Let's go check it out.
Our first practice.
Yeah.
Here.
So going back from, like, when we started from our roots, when we were just kids, when we first came to this country, and, you know, and then just not too far away from there.
I don't think people understand the irony too. Like, when we first grew up over in Danbury, over on 7 Mile, Dr. Kuhn and Dr. Kuhn, the 2 brothers, and we took over this practice. This practice was actually first started by 2 brothers, Doctors Bauer. So the Bauer brothers had this practice. Then they sold it to a hospital. Hospital was shutting it down, and then right before they shut it down, we took it over, and then came in and operated this to this day.
So maybe you want to take everybody on a little quick tour?
Oh yeah, it looks nothing like when we first started there, but we can at least show, like, again, what it looks like now and some of the new things that we're going to be doing in the near future. Because, you know, our patients are used to always adjusting and changing things inside there. Always trying to make it better for the community.
Sure.
Let's go inside.
Oh, yeah. All right, everybody. Well, welcome back. Now we're inside here.
Over the years, as we had access issues with our patients, and we wanted to make sure we added more services to kind of make it more convenient for them, and seeing all ages, what we added over time. You see here, we have physical therapy on site, we have exercise physiology, we have our radiology here, so digital x-ray. We brought in services like OB-GYN, and we brought in cardiology, and now you've expanded and continued to expand like the different service lines at each location. Here at this location, now we've added even our full diagnostics. We also have our lab here, so again, full functional lab. Makes it convenient for patients so we can draw the stuff and get it done. We brought in behavioral health, we have psychology on site.
And this is where all the action happens, right? So in here is essentially where we have our supervising doctors and all our wonderful APPs, and everybody's seeing patients, collaborating, go over things together. Now you guys have kind of seen us from where, all the origins, where it started from, where we grew up, where we went to school, things that kind of help drive us in regards to like our passion and mission from wanting to kind of give back.
Our old Detroit stomping ground, and why we're so passionate about, again, certain communities and how do we give back into those communities. And then a flash forward 20 plus years,
right.
Our first medical center.
Where we took over a dying practice that was
ironically still by two brothers.
Right. And then they essentially came in and did our thing and gave good quality healthcare, and it grew and started just really growing and expanding, and then realizing like, hey, this is our passion. This is what we want to do. We want to give good quality healthcare to as many people as we can. Come on in if you have any symptoms.
EpicHS.org, the line, you can self-schedule, make sure that you go ahead and come in. We're always looking for new patients, so if this is the kind of care you would like to have for you and your family, please give us a try.
Be looking forward to seeing you soon.